Hello, I am Nola Agner-Davis. I'm the Public Information Health Educator for Polk County Health Department, and today we are talking about all of your questions surrounding COVID-19 or the 2019 novel coronavirus. So right now we know that COVID-19 or novel coronavirus is spreading internationally. We've seen cases in the United States. However, we have seen no confirmed cases in Iowa at this time. So right now, coronavirus poses little risk to all Iowans. The 2019 novel coronavirus, or COVID, is called a coronavirus. Now, believe it or not, everyone has had a coronavirus sometime in their lifetime. It's like a common cold. However, this coronavirus, novel coronavirus, should not be considered the same as a common cold. So we believe that COVID-19 spreads through respiratory. And what that means is when you cough, talk, or sneeze, those droplets come out of your mouth and can land into the eyes, nose, and mouth of a person walking by. This person is normally within 6 feet away from you. Another way that COVID-19 can spread is if a person coughs, talks, or sneezes and then touches an object, and then another person touches that object and then touches their eyes, nose, or mouth. That is another way that those germs can spread, and you can become infected with COVID-19. So an individual may be coughing right now, and they are not infected with COVID-19. Right now in Iowa, it is flu season. We are seeing widespread flu activity throughout Iowa. So it may be the individual has the flu or another respiratory illness. Does not necessarily mean the person has COVID-19. Now, a person has to have COVID-19 if they have traveled to an infected country or their family member has had COVID-19 or traveled to an affected country. So just because an individual is coughing does not mean that they have COVID-19. Well, that's a good question. Should you be tested for COVID-19? Now, the answer is, have you or someone that you are in close proximity have traveled to an infected country? Now, if that is the case, call your healthcare provider and they will provide you with the correct guidance on what to do in case you have become infected with COVID-19. Now again, it is cold and flu season here in Iowa. That could be another situation as well. So it's really good to call your healthcare provider, talk to them about your travel history and your signs or your symptoms, and your healthcare provider can make that decision. We protect ourselves and our loved ones from COVID like we protect ourselves from any other illness or disease. The first step I can't stress enough is make sure you're washing your hands. Wash your hands, wash your hands, wash your hands. One of the best steps that we can do is make sure we're scrubbing our hands for at least 20 seconds. A great reminder is to sing happy birthday twice in your head. That's how we know we've scrubbed for 20 seconds. If you don't have clean running water and soap, use hand sanitizer. You want to make sure you have a hand sanitizer that has 60% alcohol. That will help kill the germs. You want to stay away from others who are sick. And if you're sick, you want to avoid going to school, work, or other activities. Make sure you're avoiding your T-zone. What's your T-zone? Your eyes, nose, and mouth. Think about how often we touch our eyes, nose, and mouth, and we don't even think about it. This is a great way for germs to get in your eyes, nose, and mouth and make you sick. So let's avoid your T-zone. Let's also think about when we sneeze or cough. We want to make sure we use a tissue. That will help block the germs from spreading to others. If you don't have a tissue, use your elbow. Achoo! Also, another thing to think about is when you're disinfecting surfaces. Think about things that are often touched in your home or work and make sure you're disinfecting those surfaces. There's a lot of great killers of germs, cleaning products that you can find. Visit Polk County Health Department's website and look for products to help clean your home or your office from COVID-19. Well, that's a great question. Should we be wearing face masks? So the CDC, our Surgeon General, Polk County Health Department, Iowa Public Health do not recommend you to wear face masks. Right now, there's a shortage of face masks, and this is especially important for our healthcare providers. If our healthcare providers do not have face masks, we cannot take care of those who are critically ill. So I just got a package at my house and it was shipped from China. Am I at risk for COVID if I open it? Well, there is no evidence that shows that if I open this package and it's shipped from China, or there's items in it that were made in China, that I'm going to get COVID-19. COVID-19 is an ever-changing, ever-evolving health crisis. Information changes hourly, information changes daily. We want to make sure that Polk County residents are safe from COVID-19. And you can do this by checking the Polk County Health Department website. We keep it up to date on information that pertains to you and your organization. So with that note, make sure you're checking our website and you're always washing your hands.